This meeting is moving along a lot more quickly than a few in the past. I'm thinking that most of you are here today for this item, or many of you, and it is wonderful to see so many bright, shiny, engaged faces of all ages. And I am very glad to welcome you all here and to welcome this team in front of us. And we are here today to discuss a drug take-back ordinance. This is actually the we'll be setting the merit hearing today for several weeks off, but I did want to use this time instead of just doing the first reading and setting the merit hearing. I thought it was appropriate with this item to actually do a fairly in-depth presentation, and I see the team is here to do it. And I just want to start before I hand off to you, say my thanks, and I'll say them again at the end of this, for your work, Dr. Willis and Jenna Brady and Rebecca Ng and all the people behind you in our workplace, and then also all the people who worked with you and alongside you on this effort from day one. So with that, I'll turn it over to you, and thanks for being here today.
Thank you. Good morning, board. Good morning, community. Thanks for this opportunity to help us address one of the most important public health priorities for this county, which is the problem of pharmaceutical drug misuse and abuse. You'll be hearing an ordinance today, considering an ordinance regarding bringing pharmaceutical manufacturers into a position of shared responsibility for a county-wide system for the safe and convenient disposal of unwanted home-generated or home medications. I'm going to offer you the public health perspective on this and the public health rationale and a bit of the background of how we got to this as a recommendation. And then my colleague, Becky Ng from Environmental Health Services, will be presenting the environmental health justifications for this and some of the elements of the ordinance itself with the support from Jenna Brady, County Council. You're probably getting very used to this slide. This is the Robert Wood Johnson Foundation County Health Rankings. Marin County now for the 6th year in a row has been ranked the healthiest county in the state of California. We are ranked according to 30 indicators of health to the other counties in the state. And we rank in the top half in almost all of those indicators, in 28 of the 30, with the notable exception of 2 that relate to substance use. Excessive drinking, and that's binge drinking among adults, and drug poisoning mortality. Drug poisoning mortality was added to the county health rankings last year in response to the national epidemic of prescription drug misuse and abuse. Also, in response to this, at the federal level, the White House developed a drug control strategy around preventing prescription drug abuse that contains 4 pillars. The third of those, you'll see, is safe drug disposal. This strategy with its 4 pillars sort of represents the need for a comprehensive approach that doesn't just take one element into account. There is no single solution to this issue. This problem will be solved through a multitude of interventions at various levels happening in parallel. And we in RxSafe Marin have designed a system that allows us to address multiple issues here that contribute to the problem of prescription drug abuse. One of the areas where I think we are still weakest is in our ability to develop a system for safe drug disposal, and you can help us with that today as we consider this ordinance. So this is a bit of the history of our process. In June 2014, RxSafe Marin was launched. We had a large community-wide meeting of about 100 people that established a 3-year strategic plan, and Take Back was established as a priority from that meeting. Because there was an ongoing unmet need there, on January 6, 2015, Supervisor Rice requested a formation of a subcommittee dedicated to safe medication disposal. On January 30th, that subcommittee met. We invited community-wide involvement, and we had about 40 people at that meeting from 14 different sectors of our community, including pharmaceutical interests, manufacturers, as well as pharmacists, prescribers, environmental health interests, and law enforcement. The recommendation from that gathering was that there be a county-wide ordinance like the one you will hear today. And on March 24th, we brought that recommendation back to the board when we were asked to draft an ordinance for your consideration. The work group that first met on January 30th met again to develop the elements of the ordinance, and that constitutes the process by which we developed what you'll see. I just want to orient us to kind of the rationale for why we're doing this. The public health impact of this issue is staggering. We have, from 2004 to 2013, more than a doubling of the narcotic prescriptions in Marin County. That's true nationally. We've seen a really strong trend in increasing narcotic prescriptions nationally. You may have seen the Time magazine cover article a couple weeks ago was called the epidemic of narcotic abuse, the biggest addiction crisis this nation has ever faced. And Marin is no exception. We've seen a corresponding increase in the number of emergency room visits for narcotic-related harm. We've also seen a corresponding increase in the number of unintentional drug overdose deaths, with 27 deaths in both 2012 and 2013. That's approximately 1 every 2 weeks. And in a community like Marin that's tight-knit and not all that big, each of those deaths has a really strong ripple effect. Over a 3-year period of our high school juniors, a survey showed that 1 in 5 had used painkillers for recreational purposes, so narcotics being used by high school students. And importantly, the second bar there shows that cough and cold medicine, which is over the counter, is also one of the more common drugs of abuse among our teens. This slide shows a 2013 study of all of the leading causes of overdose deaths in the United States in the year 2010. And this was part of the sort of wake-up call around this issue. What it shows is that prescription narcotics are by far the leading cause of drug overdose death nationally, followed by prescription sedatives, the benzodiazepines. Heroin and cocaine, number 3 and number 5 on this list, combined cause far fewer deaths than prescription narcotics alone. Also, you see acetaminophen, which is Tylenol, which is an over-the-counter medicine, is also one of the leading causes. One of the issues that has been debated in this process has been whether to include over-the-counter medications. This, I think, shows probably the most compelling evidence why we chose to include over-the-counters in this ordinance. This is data from pediatric emergency department visits. These are children under 5. In 2013 in the United States, these are emergency room department visits. It shows that the leading cause of emergency department visits for child intoxication or poisoning is Tylenol, acetaminophen. We also see ibuprofen is on that list, as is diphenhydramine, which is Benadryl. All of those are over the counter. Also, you'll see bleach and laundry packets are in there. So some of these elements that we know are sort of have an awareness already as being potentially hazardous household items actually cause far fewer poisonings than common medications, both over the counter and prescription. This is a survey of the people who are abusing painkillers, and showed that the majority of people who this is a study performed by SAMHSA nationally of hundreds of people who had abused painkillers, and what it showed was that the majority are actually obtaining these medicines free from friends or relatives. And then others bought or took them from friends or relatives, and only 4% were actually obtaining them from a drug dealer or a stranger. So unlike illicit drugs, this is a problem of the informal exchange of medications through families and friends from our medicine cabinets. So some of the interventions that we think of when we think about preventing illicit drugs like heroin and cocaine and the strong law enforcement component of that don't apply as well to this issue. This is about norms changed community-wide. I'm going to end with a little bit of math to help just explain why we think an ordinance would be an effective strategy. So we have a data sharing agreement with the Department of Justice that allows us to actually see every single controlled substance prescribed in the county, and it allows us to track what's happening. We know that there were 21 million pills of controlled substances prescribed per year in Marin. It's been about the trend for the past 3 years. That's sedatives, stimulants, and narcotics. It's 417,000 prescriptions with an average of about 50 pills per prescription. So the question is, where do these medicines end up? So here's that's at about 500 pills per pound, that's 40,000 pounds of controlled substances that are being dispensed into our community. We know from studies that about half of the medicines that are prescribed in our communities go unused. And that's because either the people feel better before the prescription is finished, or people can't tolerate the side effects, or they simply forget. So there's a lot of pharmaceutical products that are basically unused and unwanted and expiring. That would correspond to about 20,000 pounds of unused controlled substances in our county. Environmental Health Services, and Becky will talk more about this, sponsors, has some manages a take-back system, and last year they took back 7,500 pounds of medicines. We estimate about 20% of those are controlled substances. So what that means is that less than 10% of all of the controlled substances that are unused or unwanted were actually successfully dispensed in a safe and convenient way through our current take-back system. So there's a large gap there. And the question is, what happens to those medicines in that gap? Every day that a medicine is unused or unwanted or expired represents a risk for that medicine to be misused, abused, and eventually disposed of improperly. Half of those medicines are disposed in the trash, and 1/3 are eventually disposed in a sink or toilet when people are surveyed in terms of what they actually do with their unused and unwanted medications, which is unsafe for the environment. So to summarize, the major risks of improper disposal practices are accidental ingestion of prescription and over-the-counter medicines, illegal use or theft by family, friends, workers in homes, open houses. We hear from real estate agents that some people come to open houses and actually will go through medicine cabinets to see if there's any pharmaceutical products there. And because of the high burden across the community of these medicines, it's not unthinkable that they might find some, and then break-ins, and obviously the addiction and overdose risk represented there. And finally, the environmental impact, accumulation in our waterways and harmful effects on the environment and wildlife, which Becky will speak more about, and also talk about the elements of the ordinance itself. Thank you.
Thank you. Becky, before you start, are there any questions for Matt on the first section of this presentation? You want to wait? Are we all good? All right. Becky?
Thank you. So, as you heard, home disposal is not a safe option at home. So, just to go back to the threats to the environment, wastewater treatment plants cannot remove the drug compounds being flushed down toilets and sinks. The compounds actually pass into wastewater that is released into surface waters. And in those surface waters, including San Francisco Bay and groundwater, over 80 pharmaceuticals of various prescription drug classes have been found in this treated wastewater, surface water, and groundwater. So the impacts to fish are exposure to hormone medications, which have been shown to have reproductive side effects and feminization. Also, exposure to common antidepressants have been shown to cause developmental delays in frogs, fish, and other species. Okay. So currently, Environmental Health does oversee pharmaceutical return program, but the challenges to our current program is that the responsibility rests with local government and our districts. The manufacturers do not share the responsibility. Therefore, there's a lack of funding and resources to expand and promote the program. Currently, we have 16 sites, which we believe are not enough, and they are not convenient or accessible to all residents in the county. Only 8 of the sites allow for legal take-back of controlled substances, such as painkillers. This is a map of the showing the current 16 sites. The purple sites are our law enforcement agencies that can take all drugs, including the controlled substances. The red sites are the other collection sites that can take drugs except for the controlled substances. You will note that most of the sites are located along the Highway 101 corridor. So a lot of the other parts of the county are not readily accessible. There are 4 counties, city and counties, that have safe drug disposal programs at this time. I'm going to have Jenna Brady address those.
Good morning, supervisors. So currently, Alameda County was the first in 2012 to pass their ordinance. It was challenged in the courts, and the Ninth Circuit held that their ordinance was constitutional. It was appealed to the Supreme Court, and in May, the Supreme Court declined to hear the challenge. So currently, the only legal challenge has been to Alameda's, and it was confirmed by the courts. Since then, San Francisco, San Mateo, and Santa Clara have all adopted ordinances. The one that we're proposing to you today is substantially similar to the last 3 that have been adopted in that it does include over-the-counter drugs, whereas Alameda does not. But the specifics of the program and implementation will be substantially the same.
Okay. As Jenna mentioned, our ordinance is very similar to the other counties. The ordinance is based on the concept of extended producer responsibility or product stewardship, which makes the product manufacturers responsible for the full cost of their products, including disposal. Other products that this concept has been applied to are batteries, paint, mattresses, just to name a few. The proposed ordinance will require the pharmaceutical manufacturers to submit a stewardship plan on how they will collect and dispose of residential unwanted drugs. The ordinance will apply to manufacturers of prescription as well as over-the-counter drugs. This is the main difference between Alameda counties and the other San Francisco, San Mateo, and Santa Clara. All costs of the program will be borne by the producers with no point of sale costs to the consumer. Also, the plan approval, implementation, and enforcement will be administered by environmental health. Okay. This is a map of the county with the districts. What is proposed is a minimum of 25 collection sites geographically located in the county. Producer, just to inform, is a manufacturer of a prescription or over-the-counter drug sold in the county, and this would include brand names as well as generic drugs. Okay, components of the stewardship plan, which the producer is required to submit a stewardship plan to environmental health within 1 year of the effective date of the ordinance. The plan must include how they will educate the public, how they will promote the collection program, the location of the minimum of 25 location sites geographically distributed in the county, a description of the number and location of collection events, and a description of how they will make mail-back envelopes or services available to residents who cannot travel easily. Okay. This is a proposed ordinance implementation timeline. If the proposed ordinance is adopted, it will become effective September 11th. Within 6 months after the effective date, wholesalers and producers must notify environmental health of their intent to participate in the program. 1 year after the effective date, the producers must submit the stewardship stewardship plan. And 15 months after the effective date, environmental health conceivably will approve the plans, review the plans, and approve them. And by March 11th, the stewardship plans will be operational. And plans will be made available for public review. So, collection and disposal costs. The proposed product stewardship program, the estimated costs for industry for collection sites, collection events, and mail-back services per year. The pharmaceutical industry itself estimated $1 million to $1.2 million per year. San Mateo County had estimated only $250,000 per year for 25 sites, and Alameda County has estimated approximately $300,000 to $330,000 per year. Okay. Environmental health program plans. Half a FTE funding has been allocated for the ordinance implementation, and a resolution will be brought to the board soon after adoption for the approval of program fees. And the program will become self-supporting in 1 year from fees generated from the stewardship plan submittals and approval, plus changes to the plans, and then annual report reviews. That concludes our presentation. Are there any questions?
Yeah, I'll have a couple questions, just clarifying questions myself first and then hand off to you all, hoping you have questions. First of all, this is a countywide, this would apply countywide, so would apply to cities and towns, and or take-back sites could reside in cities and towns, yes?
Yes.
That's correct. It would apply to both incorporated and unincorporated areas.
Okay, and then what sort of outreach has been done to the cities and towns with regard to the ordinance we're considering?
I met with city managers last week Dan Eilerman suggested that they would want to be informed about this ordinance because it is a little bit unusual and that it is countywide, and most of our ordinances have to be adopted individually, each town and each city. There was a very positive response among the city managers. In fact, they sort of jokingly asked if we could have more ordinances that just applied across the entire county as an efficiency step.
I'm not sure if they're bosses.
Yeah.
Necessarily.
Oh, and I would like to add that we did prepare a one-page summary that was submitted to the city managers as well as the mayors a week or two prior to this meeting.
And then a question on the regional end, wondering, you listed off 4 counties and the city and county of San Francisco who have adopted ordinances. Are there other counties in the queue looking to be adopting similar?
Informal discussions with environmental health directors in the state. I believe, I have been told that Los Angeles County will be considering a similar ordinance, and they are scheduled to address their Board of Supervisors in August. The city of Long Beach has also asked me for information regarding our ordinance, and I've also been told San Diego, Santa Barbara, and Sonoma County are also considering similar ordinances.
And then with regards to the program implementation and costs, you're comfortable with covering some one-time costs towards getting this up and rolling, and there's the potential also to be recovering our upfront costs as well as establishing fees that would cover the ongoing program going forward once this is established?
Yes. We, Environmental Health, as well as Health and Human Services and Council, have been participating in working group surrounding safe disposal ordinances. And so Environmental Health will be working, collaborating with the other environmental health agencies in implementing their programs. And we are very comfortable that with the sharing of next steps, we are comfortable with the current funding, and that we will be able to come up with a reasonable fee schedule.
All right, and then why 25 sites, and I'll hand off to you guys. Why minimum 25? What was that? Why was that number chosen? Curious.
We thought that we started with 50 actually was the initial thought. We really wanted to see norms change here. We wanted it to be incredibly easy for people to just drop off. As soon as that therapeutic end of life for that medicine is reached and it's unused and unwanted and expired, it becomes a potential source of harm. So we thought, wouldn't it be, and there's this internationally in Mexico and Canada and Europe, there are take-back bins kind of commonplace throughout the community. So 50 is not unthinkable if you think about this in a totally different way. We modified that to be 25, 5 per supervisory district, based on population estimates and conversations with some of the other counties on what we thought would be the minimum necessary to move forward. So that is a minimum. Certainly we would be happy with more.
Right. And presumably, as we move forward with this, it could be, we see a culture shift, and actually it becomes a benefit to pharmacies and other drug and dispensers to have a take-back facility on site. So I'm thinking 25 is a minimum, and hopefully voluntarily we see a much larger number if
We have
this goes
30,
forward.
there are 30 pharmacies in Marin County, and those are surveys of communities. So that's where people would think and would want to take back their medications. There's also a number of police stations that currently, because of the controlled substance restrictions, are also host sites. So between those, we have potentially up to 50 eligible sites if we just include the law enforcement agencies and the pharmacies.
Right. Okay, questions from my colleagues. Supervisor Arnold.
Thank you. 2 questions. Number one, I'm curious, it only shows one take-back site in San Rafael and one in Nevada. Do we know why that is? Or is the map not?
I believe that the map probably is not depicting them correctly, because there are definitely more sites in San Rafael than one. And Novato has at least 2 or 3 that I can think of off the top of my head.
Yeah.
The fact is that the sites where they currently exist are not due to a systematic process. So it is possible that there's a really sort of mismatch between the population of an area and the number of take-back sites. We see that in Southern Marin. You'll hear from, I think, the police chief of Mill Valley that, there's not enough sites there, so their site that they host is constantly being filled. So part of the justification for the ordinance is that would be a much more thoughtful and systematic approach to making sure that every single person has a place that's convenient for them.
Okay, and my second question is, what exactly is involved in a safe elimination of drugs? What, on the ground, what do they do? What do you do?
The key to the success of this program will include education of the public, to have them develop a culture, habits, whatever, to bring their unwanted drugs to these collection sites.
So then what happens from there?
And then from there, currently, the way it is operated at this time, we have it looks almost like a mailbox that you can put your drugs in a baggie and then put it into, open the chute and put it in. And they're locked.
Then what do you do with them?
So then we have medical waste or hazardous waste hauling company come to the site and open the mailbox and take them out, and then they eventually bring it to incinerator, where it's incinerated.
Okay, thank you.
It's like a form of garbage collection. They have their rounds and they go from one site to the other and collect them and then bring them to a centralized site for safe disposal, which is in this case incineration.
And there are regulations that guide all those steps. Supervisor Kinsey.
Thank you. Yeah. I do think that the map should get a good checking. I thought maybe Supervisor Arnold had traded off a handful for my district, so I'm disappointed. But
I'm sorry, that map is those are the cities. Oh, I'm sorry.
Cities only. Okay, great. We're a one pharmacy West Marin. But I have two questions. One is, you didn't mention anything about the folks who prescribe these millions of drugs. What's their role? Where are they here today? How will we involve them? That's another piece. You don't even start it, before you even get to having to throw it away. And then secondly, in this balance, where do you place your emphasis? You seem to be pointing towards our teen or our young adult populations, but you also mentioned seniors, and when we look at that, it looks like a ski lift going up, climb. What percentage of that is the aging population? How much is just the fears in the industry around liability? Maybe we could break that down, not today, but over time. I think it'd be helpful for me to understand where we're trying to point our priorities.
Your question regarding the prescriptions, I don't think we think this is the solution to it. This is not the sole solution to this problem. In fact, this is one small part of the equation. This is something discrete, discernible, and something that will be effective and something we can actually take action on now. Reducing the number of prescriptions is probably even more important as a step, and we are working very hard with our prescribers through RX Safe Marin to help with continuing medical education, sharing the slides, the data that we have, local data available to us around the harm of these medicines with our prescribers has been a very effective strategy for helping them rethink the way they prescribe. And we're seeing early signs that we're seeing pretty dramatic decreases in those super high doses of some of the narcotic prescriptions. In the Medi-Cal population, we've seen a 40% reduction in the average dose of morphine that's being dispensed in 2015 relative to 2013. So I think we're making some headway on the supply side of this in terms of what's actually being dispensed in the community. We need to do more in terms of getting them out.
All right. Supervisor Connolly.
Thank you. Just a few things, and thank you for the presentation. Going back to the 25 number, and I'm glad to hear that that's perceived as a baseline, and the goal is really to make sure that there's meaningful access throughout the county. In terms of paying for the sites, how are costs allocated? Are the manufacturers who do business in Marin paying into a fund, which in turn is used to fund the various sites, or are particular manufacturers responsible for particular sites? How does that work?
So we've been working with other counties on learning how their implementation process has worked, and so far what we've learned is a lot of manufacturers are joining together to participate in stewardship plans, and they'll have a plan operator who pays for all these costs, and they're just now starting to enter into contracts. For instance, if law enforcement wants to host a site, my understanding is a couple of the counties are actually working on getting them to pay for even maybe law enforcement oversight of that bin, so that there'll be no cost if a pharmacy or law enforcement want to voluntarily host a site. So that's our hope, is it'll be completely funded by the stewardship plan, and it looks like in practice that's happening.
You reflected on the anticipated timeline for implementation of the program. I appreciated the slide. I was trying to do the math in my head, reading the staff report, but it does look to be about an 18-month to 2-year time frame. That seems long to me. if you could comment on that time frame as our way to expedite, knowing that there are certain inherent limitations with how fast government works, but this is such an important issue.
The timeline was mostly developed because of the inability to identify producers in a timely fashion. So we have worked into this ordinance that wholesalers, which do have to register with the Board of Pharmacy, will hopefully be able to give us which of those producers are actually have their drugs sold in Marin County. But mostly it's to allow from the time they have to notify us, which is about between 3 and 6 months, depending on if you're a wholesaler or producer. It then gives them, I believe, approximately another 6 months to work out a plan for us, and a lot of them are joining together, so we would only get, for instance, Alameda has gotten one minor plan with just its one manufacturer who has one single drug sold in the county, and then they've had another bigger plan that a lot of producers are actually joining in on, and that just is efficient for the producers and will be efficient for the county to review as well. And then it's about a year for them to get us the plan, and then we're factoring in environmental health may not take 3 months to review. If we're getting the same plans or similar as other counties, it may be a much faster implementation. That's kind of what we're anticipating the longest scope is. And we're monitoring what's happening in San Francisco, San Mateo, and Santa Clara to see if they're getting them faster.
Okay. On the over-the-counter issue and inclusion of that in the ordinance, I agree with that, and had just a couple of questions on that. But I think we've seen an evolution in these ordinances. The earlier ones, like Alameda, focused on prescription. The more recent, San Mateo, San Francisco, are including over-the-counter. Dr. Willits, you commented on one reason, which is obviously critical, and that is accidental poisoning of kids. I think there's another compelling reason, and would be interested in your thoughts on what you've seen in your research on this. But it seems to me that once we do these programs, that consumers actually do return a lot of over-the-counter drugs to these bins. That, in other words, they don't just limit it to prescription. So in effect, from an economic or cost-sharing standpoint, really you have both prescription and over-the-counter products at issue in terms of what's being returned. Is that a fair statement?
We don't think it's realistic for people to sort their medicines according to what's acquired over the counter and what was prescribed, especially since there are some medicines where a certain dose would be a prescription strength dose and another dose is an over-the-counter dose. The lines between over-the-counters and prescription medications are blurred. And you're right. So as a result, we would love our message to our community to be bring back your unused and unwanted medications, period, without regard to what class they might fit into, because we don't feel as the community has that, has that knowledge. So it's both there's a public health argument for including them. There's also an equity in terms of the fairness to over-the-counter and prescription manufacturers to include both, because at the end of the day, they would probably both end up in the bins anyway.
Right. Then finally, I wholeheartedly concur in my colleague's point about prescription practices, and if there's anything we can do in terms of education, enforcement at the local level. I recall having knee surgery personally a couple years ago, and was probably prescribed about 2 to 3 times as much Vicodin as I could possibly use as a painkiller. And I'm sure I'm not alone in that. Those drugs end up sitting around in the medicine cabinet, ultimately getting disposed. In the context of the national epidemic you talked about that we're facing with opioids and painkillers, it seems like if there's anything we can do locally on the prescription side as well, that would be great, in addition to working with state and national initiatives in that regard.
There are some prescribers here today who are part of RX Safe Marin and are some of our leaders and our champions around that effort countywide who will, I think, have a chance to speak.
And I go out for public comment on this, but I'm just on towards the issue of sort of addressing this issue across the spectrum from the birth and prescription of the pill to the disposal. One of the things that we haven't talked about today and isn't addressed in this ordinance, but is something that we do need to address as a community, is the treatment aspect of this, because there are folks who are, I mean, the prescriptions are being written for legitimate purposes. These drugs are highly, highly addictive, and we don't have probably the support for treatment that we really need. We can't address that today and with this ordinance, but I think it's worth noting. So at this time, I would love to hear from the public and the representatives from the various stakeholder groups that were part of RX Safe Marin and part of this effort, and I'm so glad that you're here today. Good morning.
Good morning, and thank you. My name is Patty Garbarino. I'm president of Marin Sanitary Service and its related companies, Marin Recycling and Marin Resource Recovery Centers. I'm also a member of the Marin County School Board and here to speak to the effects that a lack of proper drug take-back has on both of the communities that I serve. I'm here also to laud you in your efforts as well in joining many other forward-thinking communities across the country and in many other developed countries to remove unneeded pharmaceuticals from the waste stream, but most importantly from those who would be harmed by their unintended uses, as you've already heard. The alarming statistic of 54 deaths amongst our young people is absolutely unthinkable. The environmental effects of improper disposal of these drugs is also tragic. Did you know that groundwater within a 50-mile radius of any well-run landfill like ours is contaminated by the stuff that's in it? I'm very proud not only to be a part of RX Safe Marin, and look at our collaborative effort. I'll just remind you of this. This was a wonderful tool that I think was the first of its kind, and thank you all who had a part in putting this together. Education is where we get started. I'm also a board member of the California Product Stewardship Council. Both of these groups, this group, RX Safe Marin, and the Product Stewardship Council, have been bravely trying to find a way to get the pharmaceutical companies to do what other manufacturers have done, batteries, mattresses, carpet, and the like, to do the right thing, to take back their unused manufactured material for pennies on the hundreds of dollars instead of fighting the cause, and deal with them in a safe, humane, and environmental fashion. Once again, I laud you for your brave efforts to help in this regard. And regarding your question, Katie, I just have this one picture out of the 1869 in my phone that I found. Raccoglitori medicali scaduti. In Italy, they have drop-off boxes in a small village where we come from, everywhere outside of pharmacies, and it works. Hard to imagine given that it's Italy, but it works. Thank you.
She can only say that because, yes. Good morning.
My name is Steve Devine. I'm the program manager for the Marin County Hazardous and Solid Waste Joint Powers Authority, also known as Zero Waste Marin. And we're also here today in support of this ordinance. This ordinance is consistent with our legislative platform, which promotes the concept of extended producer responsibility and having manufacturers take ultimate responsibility for the products that they manufacture. Currently, the Solid Waste Authority, along with several of the wastewater districts, supports the Environmental Health Department in the costs that they bear for the collection of both the pharmaceuticals and the Sharps program. And so we're looking forward to having a more broader participation of the community and the manufacturers in taking part in the costs in running this program. And we strongly support and urge your support of the ordinance. Thank you.
Thank you. Good morning.
Morning. My name is Dustin Ballard. I'm an emergency physician with Kaiser Permanente in Terra and the EMS medical director for the county. And I'm going to speak specifically on my experience in these two areas in supporting the Safe Disposal Stewardship Ordinance, and thank you all for taking this up. So others have mentioned the staggering numbers, both nationwide and here in Marin, regarding the impact of not only prescription narcotics, but also other medications that are in surplus in our homes. I will just add two quick addendums to those statistics from the CDC, that drug use and abuse of prescription drugs leads to approximately 2.5 million ER visits each year in this country. That was 2011. And in 2013, they estimated that nearly 2 million Americans under the age of 12 abused or were dependent on opioid painkillers. So there is a huge problem here, and I see the ramifications every day, both in my practice in the emergency department as well as in county EMS. In the ER, it's not uncommon for us to see kids who have overdosed from farming parties where they took excess drugs from their parents' medicine cabinets, poured them into a bowl, and then just took whatever it was. And so it's not just the opioids here. Of course, blood pressure medications, especially in small children, can be really harmful. So I do agree with the idea of the Take Back ordinance really covering all these medications that could cause harm. Many people, of course, come in, they've been on chronic pain medications. It's a problem that starts often with a prescription that's more than it needs to be. It quickly turns into dependence, and once it becomes dependence, it can be really hard to break, and patients will do really amazing things to themselves in the name of trying to get some more drugs, and I see that every day. Someone just yesterday wanted me to refill the 700 pills of oxycodone that had been prescribed to them and were stolen when she was in alcohol detox. In our EMS system, our ambulance and our medic providers also deal with this commonly. We ran some numbers in 2014. Narcan, which is the antidote to opioid overdose, was used 164 times, and that is more than the use of glucose, which is the common treatment for hypoglycemia, or nitroglycerin, which is the common treatment for angina. One quick example, no identifying information, but a middle-aged woman was transported for an overdose. At the scene, the medics reported finding at least 25 empty prescription bottles, the majority of which were for diazepam, which is Valium, oxycodone, which is Percocet, and morphine. So we all recognize this is a multi-layered problem. RX Safe Marin has done some great work. We've introduced their community prescription standards into RED and have already made, I think, really strong efforts towards limiting supply of narcotics for acute painful injury, because we know most people don't need more than 2 or 3 days. So with that said, I think it is important that with steps being taken, that we all do our part, and this Safe Stewardship Ordinance allows for another entity that contributes to the problem to do their part as well.
Thank you. Good morning.
Hello, my name is Brittany Lobo, and I am the project coordinator for the Novato Blue Ribbon Coalition for Youth. I'm speaking today on behalf of all of the local drug and alcohol prevention coalitions in the county, including the Novato Coalition, Mill Valley Aware, West Marin Coalition for Healthy Kids, Twin Cities Coalition for Healthy Youth, and the county-wide coalition, Communities Mobilizing for Change on Alcohol. As Dr. Willis alluded to, in Marin, nearly 1 in 5 teens report having used prescription narcotics to get high, and many report easy access to drugs in home medicine cabinets. And at the same time, overdoses from prescription medicines, particularly opioid painkillers, cause more deaths than heroin and cocaine combined, according to this CDC. So towards addressing this multifaceted problem, and as you've heard from other stakeholders here today, a broad coalition of stakeholders from the joint community coalitions of Marin County, RX Safe Marin, public health, law enforcement, the medical community, education, pharmaceutical retailers, environmental health, waste management, have all been working together to develop programs around prevention and education and to make recommendations that inform policy. The joint community coalitions of Marin County urge the Board of Supervisors to pass the proposed safe medication disposal ordinance, which would allow for take-back bins in convenient locations. So I think for me the biggest point around this ordinance is safe and convenient disposal of medications, because we do know that we already have safe disposal locations in some places around the county, but we want to make sure that it's convenient for people and really get to changing norms. So by supporting this ordinance, medications won't end up in the wrong hands or in the wrong place. Thank you.
Thank you. Morning.
Good morning, and thank you. I can't tell you how absolutely thrilled I am that this ordinance is before you. and I absolutely urge your passage. I'm Judy Schriebman with the Galenas Watershed Council, Las Galenas Valley Sanitary District Watershed Alliance of Marin, and along with the human costs, which we are going to be hearing, which you've heard from, the environmental costs are huge, and you heard wonderfully from Patty Garbarino about that. So at the wastewater treatment plant, that stuff comes to us if it doesn't go to the landfill. That's a toxic brew of chemicals that comes into a treatment plant that in most cases in Marin is not designed to take care of getting all these chemicals out. And we do our best. But that's another outsourcing of the costs from the pharmaceutical manufacturers to the community. So they reap the profits. We pay for taking all that stuff out of the landfill, taking it out, taking it back in every location. I love the idea of it being convenient. I have a personal story too. Again, when my father was dying, we were working with hospice, and he was on a number of medications too. At the end of that, being where I am, I knew what to do with them. I knew to find a take-back location. I knew what to do with that. Many people in that situation are not aware of what to do. Things get cleared out. You're in a trauma of someone dying. They're bagged. They're thrown in the trash. They're dumped down the toilet. Or, you know, who knows, someone coming to clean up the closet is taking them out and selling them on the street. So this ordinance is critical, and I thank you again very much for having it before you, and please vote for it. Thank you.
Thank you. Good morning.
Hi, good morning. My name is Angie Minetti, and I'm here on behalf of the California Retailers Association in support of the ordinance before you today. We believe what is in draft, or what's before us today, provides a workable solution. It's balanced, it's consistent with our members' philosophies and current practices. Right now, various members of mine, which also include chain drug pharmacies and also pharmacies and grocery stores as well, you know, we participate in collection events. We have sort of been a part of this issue and offered mail-back envelopes to our customers as well. But as these ordinances are rolling through, we've definitely been appreciative to the county to include us in stakeholder conversations early on, just as we've been included in conversations in some of the other localities that have adopted ordinances. So I wanted to make sure to show up today and express our appreciation and support, and also to just voice our willingness and desire to start collaborating with the counties in exploring various methods where the retailers can start to increase access and convenience, not only for residents in Marin County, but also for residents in other areas as well.
Great.
Thank you.
Thanks so much for coming today. Good morning.
Good morning. My name is Christine Flowers, and I am the Program Manager for the California Product Stewardship Council. CPSC is a nonprofit which formed in 2006 to educate and support the implementation of extended producer responsibility, and we strongly support this ordinance. Our board is comprised of both public and private sector members working towards this goal, and we want businesses to thrive, and they do in this model. We are the ones that have developed fact sheets for EPR on meds for European countries, including France and Portugal, and as near as Mexico, Brazil, and Colombia. Some of the Canadian provinces also have successful programs for both pharmaceuticals and sharps designed to operate by the private sector. This ordinance aligns with those models. Our expertise led CPSC to co-sponsoring state legislation, which has failed in the past 2 years, resulting in Senator Jackson sending a letter to the county supervisors statewide asking them to adopt these ordinances. This policy approach works well all over the world for a variety of products: batteries, packaging, pesticides, paint, sharps, medicines. CPSC has long received strong support from Marin County, with the county helping CPSC form in 2006. Carol Misseldine was a founding executive director, and as mentioned before, Patty Garbarino has been a long-term board member. The town of Fairfax, the city of Larkspur, the city of San Rafael, and Marin County Hazardous Solid Waste Management, JPA, and Tamalpais Community Services District are among the 138 county, cities, special districts that have passed resolutions in support of EPR. We have been participating in the stakeholder meetings, and we realize that pharmaceutical disposal is a growing problem the public wants solved. CPSC has specific data for this topic from other jurisdictions, including the City of Roseville, Santa Clara County, and San Mateo counties, where we've been working with them on projects establishing new pharmaceutical collection bin programs, as well as developing these types of inserts, which Ms. Garbarino showed you. Through this project work, we've also done surveys, we've been able to learn the following. Many of the public expressed frustration with the lack of convenience with the current disposal options. Even when there is funding to implement these programs, buying bins at $1,000 with grant funds, it does not go over well with the pharmacies when the drug producers do not have a cost or share in responsibility. The local governments can't afford the cost of the program. It's time for the public to weigh in. The Supreme Court has refused to hear the industry appeal, so it's time for the public. With the cost to industry would be 1 cent per $100 prescription, and the producers would pay that as a cost of doing business, not as a visible fee. In short, we support the adoption of the ordinance. It aligns with best practices, with effective designed programs funded and operated by the medicine producers. Thank you.
Thank you. Good morning.
Good morning. My name is Andrea Ventura, and I'm here on behalf of Clean Water Action. We have approximately 55,000 members, most of whom are here in the Bay Area, including your constituents. And I'm here to say that our members overwhelmingly support these ordinances, including the one that you are thinking of today, and I want to thank you for your leadership on this. I was going to review the environmental effects, particularly on water, but you've actually heard from Ms. Ng and others about that. I won't repeat that, except to say that these effects are very well documented here in California and elsewhere. I have piles of papers from around the world, including California, to talk about what happens to wildlife. The types of drugs found in California waters, including San Francisco Bay, are antibiotics, over-the-counter analgesics, birth control, anticonvulsants, etc. I don't need to list them all. Levels of antibiotics in the South Bay have reached levels of concern for wildlife and the environment and water quality. Studies have also shown medications collecting in the tissue of mussels here in San Francisco Bay around the bridge, which are, of course, food for both wildlife and human beings. Every paper I've ever read about this has said something very interesting at the end. They all say, though these things are found at trace amounts in drinking water or in seafood that people eat, we actually don't know the long-term effects on humans. We don't know the cumulative effects of these cocktails of chemicals, and we don't know the effects on fetuses or vulnerable populations, which is not to say that we should all be panicking. It's to say we need to take action as drug use increases for health benefit, and we need to be keeping these out of the waste stream. We know for sure that even while this is not a panacea, we will keep tons of pharmaceuticals out of San Francisco Bay and our local drinking water sources. We've seen that from even the limited programs. Finally, I want to say that what we hear from our members, and we talk to our members every day, is that yes, industry needs to step up to the plate because the consumer is already paying 3 times. They pay higher prices for medications than they do in other countries where there are collection programs. They pay for wastewater treatment and drinking water treatment, environmental cleanup, and social programs, and they're currently paying for the collection. And so it's time, they believe, for the manufacturers who profit legitimately to step up to the plate and do their share to protect our water. So again, thank you, and thank you for your leadership on this issue.
Thank you. Good morning.
Good morning. I'm Bruce Livingston. I'm the Executive Director of Alcohol Justice. I just want to mention, I'm so proud to be testifying after Clean Water Action. I was the state director, founding state director, 1990 to 1995. We were the first environmental group to endorse Jared Huffman and helped him get elected. Anyway, you know, opioids are the leading cause of death by drug after tobacco and alcohol. It is so important for us to be working on this. I'm very proud of the county here for taking action. You're very much in sync with the action that's going to be taking place in Los Angeles. They're having a major hearing August 11th, the same day your next hearing on this is taking place. And there's so many counties that are doing the job that the Assembly and Senate failed to do so far. And we have to do it county by county, and you're taking the lead. Our specific concern is we want locations that are available to the canal, and we think that will be accomplished with the Wellness Center, and we hope that there's at least one location on West San Pedro Road in one of the pharmacies there. And we also are really glad Supervisor Conley expressed his support for over-the-counter medicine being included. It's very hard for the public to distinguish once it gets in your medicine cabinet. And it's, as San Francisco did, and I believe San Mateo, it's good to get those in the mix. And I just want to say one thing about the cost. And the cost of the county, $40,000, is so minimal compared to the cost of emergency room visits. So minimal. It's really cheap. The cost is being pushed on to the manufacturers, and that's appropriate, as it should be. Always push the cost upstream, and it's going to be less than a penny a pill, either through your insurance or HMO or personally incurring that cost. It's so cheap to do this. We congratulate you. Thank you.
Thank you. Good morning.
Good morning, Board of Supervisors. My name is Jorge Castillo. I'm the manager for the San Rafael Alcohol and Drug Coalition, a drug-free community coalition based in San Rafael, California. 1 year ago, we passed a motion supporting a take-back program as a coalition. We believe that excess prescription drugs in Marin pose a threat to public health, the environment, and young people in particular. Just like alcohol, prescription drugs are readily available and can cause injury and death. And making drug producers responsible to take back unused and excess drugs is good public health policy. We want to congratulate the RX Safe Marin Coalition for all the great work they've done throughout the last couple of years. And we want to encourage the Board of Supervisors to pass this ordinance to take back drugs from our communities. Thanks.
Thank you.
Good evening, Board of Supervisors. My name is Jorge Calderon, and I am from Youth for Justice, attending San Rafael High School, and I am in 11th grade. I'm coming to support this new ordinance having to do with people disposing of their medication in a safe place. I once had a mutual friend that overdosed and died by taking too many Xanax bars, which are prescription drugs, and he was roughly my age. And the point I am trying to make is that he had his whole life ahead of him, but his life was shortened because of this overdose and death. I would very much appreciate one of these disposal bins in the canal area for the safe disposal of any of those drugs that the people in the community may have in their homes and want to dispose of them. Here are some facts and statements that support my lecture. Every year, there are tons of excess prescription drugs in Marin County that pose a threat to public safety, the environment, and young people in particular. Just like alcohol, prescription drugs are readily available and cause injury and death. We all have friends who have been harmed by drugs and or alcohol. Making drug producers responsible to take back unused and excess drugs is good public health is a good public health policy. It's time for Big Pharma to foot the bill to take back dangerous, unwanted, and unused drugs in Marin County. A well-designed and well-funded drug take-back program in Marin County will make our cities, towns, schools, and environments safer and healthier. On behalf of all the young people in Marin, the kids and parents at Youth for Justice, strongly support this ordinance and applaud the Board of Supervisors for taking this positive step forward. Thank you.
Thank you. Good morning.
Good morning. My name is Christine Lamb, and I'm the Secretary of the Alcohol and Other Drug Advisory Board to the Marin County Board of Supervisors. I'm here today to share my story with you. I grew up in Corte Madera and went through the Larkspur School District. I tried OxyContin the first time when I was a junior at Redwood High School. My friends found the drug in their parents' medicine cabinet. I will never forget the feeling I had when I first tried it. All my fears and worries slipped away. The feeling was so magnificent that I would go broke just to feel it again. I became addicted the moment I tried it. I started to do things I said I would never do and did not know how to stop. The withdrawals were bone-crushingly painful, and I would continue to use OxyContin 9 years down the road. The impact this drug had on my life was as astounding as it was tragic. I had lost everything worthwhile, and one could say I was merely living just to use the drug. My mother made funeral arrangements because she did not think I would make it out alive. I was lucky that my family had the resources and wherewithal to get me immediate help. I went into treatment, then sober living, and today I stand here before you as a fully recovered, useful member of society. I have a job in the financial tech industry, and I serve on several Marin County boards. I share my story with others in the community today so they can see that there is hope and there is a way out. We must do everything we can to make this county a safer place. Today, we have the power to limit both supply and access. I hope we will make the right choices for future generations to come. Thank you for letting me share.
Thank you.
My name is Fred Mayer. I'm a community pharmacist.
Or wait, Fred, get behind the mic so everyone can hear.
Hello. My name is Fred Mayer. I'm a community pharmacist with a public health degree. I've got an article here that I wrote, Keep Kids Safe from Prescription Drugs. I represent the California Alliance for Retired Americans with 1 million consumers who are backing this proposition statewide. We have worked very hard for the past 2 years here as drug chairman, and it was voted down in Sacramento. We have a North Bay chapter here that just started up. Damon, I won't repeat all this because you'll hear about it. You're coming to our Marin County Pharmacists Board meeting next week, and I want to thank you for that. About 3 things. I won't add anything to what everyone else has added, but one of the main things, Katie, I'd like to make sure when you talk about over-the-counter drugs, as a pharmacist, Food and Drug separates OTCs, and they have another class of drugs, which is a $30 billion industry, and it's called herbals and dietary supplements. So when we're talking about OTCs, OTCs generally come under FDA, and the herbal dietary supplement, that's a $30 billion industry, should also be included. I want to make sure when we're talking OTC, we're not just talking about Tylenol, we're not just talking about acetaminophen, we're not talking about these, but we're also talking about ginseng, garlic, ginger, all these herbals dietary, which also come in. I still practice pharmacy at Marin Medical Pharmacy, where we take back these things. The second thing I want to make sure in this issue is that Kaiser has 60% of all patients here in Marin County. I want to make sure that Kaiser is a central point to pickups because of the fact that with 60% of the patients, they dispense most of the medicines. I want to make sure that they're involved in this thing, and the DEA has made it very difficult for Kaiser to participate. So in your dealings, you need to look at this. Where's the drugs coming out of? 60% of the patients are coming out of Kaiser, then they need to have the pickup there where they dispense it. The third thing is I have moved from Terra Linda, where I lived for 50 years, 60 years, 61 years, whatever. And make a long story, do I have a minute? 42 seconds.
You're fine.
I live at a place called Smith Ranch, which has 300 old geezers like me. Smith Ranch over here. And we use, although we're only 12% of the population, the seniors, you need to look at the senior population who uses the pills. We're 12% of the population, but 42% of all medicine is used over there. When I went into the local dispensary where our doctor and nurses have a place, it's impossible for them to take back because of the regulations. I want to make sure facilities like that and facilities like your Top of the Hills and the ones in Redwood have these facilities and are available. Marin County Pharmacists, Damon, as I said, we're going to be meeting. I'd like to see you pass this ordinance. I won't go into all the issues of why we need this ordinance passed, but but the pharmaceutical industry with $260 billion can't afford 1 cent per prescription. They pay for it in Canada, they pay for it in the United States, they pay for it in UK, they pay for it all over Europe. They even pay for it in Mexico. Why can't they pay for it here? And the answer is they should. So I want to make sure when you look, and the pharmacists are very pleased, but we need to make sure the pharmacies can stay in the game. And there are only 4 pharmacies now that now have these little bindles that this county picks up and incinerates. Thank you for your time.
Thank you.
What says I got 41 seconds?
No.
Oh, thank you. Thank you. And also I'd like to thank Katie Sears. This Robert Fisher who died was an employee of the Sausalito Pharmacy, and he was a great kid. And I didn't know he had 7 kids, but thank you.
Good morning.
Good morning. My name is Carol Hannon, and I'm here representing the hundreds of home health nurses and physical therapists and social workers and who encounter people at home and see when we do medication reconciliation and we get a garbage bag full of medications. This happens every day, all day long. And this ordinance would increase the possibility of having ease with, getting rid of those unused and unwanted medications. Thank you.
Thank you. Good morning.
Good morning. My name is Aglaya Panos. I'm the president of Marin County Pharmacists Association, and we're part of the Safe Marin, RX Marin. And so all the issues have been presented, and I just, I don't want to reiterate all of them. But one issue I will present is that when I was working with Project Independence and going into homes and seeing the amount of drugs that were in homes, we have to make it easy for them to get rid of them. It's hard for older people to go to the police station. They don't want to go to the police station, okay? So we need to make it accessible to them. My little prop here, I don't want her to get into drugs, of poisonings. And we know the statistics that 45,000 people died in 2012 from prescription overdose. We know all these things, so it's time to move forward. And I appreciate your efforts. Thank you.
Thank you. Be gentle with that microphone. There we go. Perfect. Good morning.
Good morning. My name is Reese Isbell. I represent California Life Sciences Association, CLSA. We're a recently merged organization, formerly Bay Bio, if you've heard of Bay Bio, and California Healthcare Institute. We're a statewide organization representing 750 different biotech, life science, medical device, university research, and other healthcare organizations throughout the state. Just as one aside, I'd just like to remind us of the good that is done by the industry that we are talking about. I personally come from a lot of work in HIV research, and I can tell you, as we all know, people were given death sentences for a day or two after. Now they're through cocktails, they're living lives many, many years longer. And it's not just that issue, it's all issues. We're all taking prescription medicine that is helping us with our pains, our difficulties, extending our lives. And so I want to remind us that that's what we're talking about here. I want to say thank you to Dr. Willis and to his team and everyone from the county for including us as part of the stakeholders conversations. Very much appreciated being a part of those conversations and being able to present our concerns with some of the drafting and the proposals. I do have to oppose the legislation today, and I'll be giving you some specifics in the letter with more details. But first of all, our concern is that one of our biggest concerns is that there's no user fee with it. Obviously, we're talking about electronics and batteries and all those other companies and industries that have recycling programs. They all have a user fee attached to them. When you buy a computer, you have a fee on there, and it says it's going to go to this. Same with batteries. You don't have that in this ordinance. So it's different in that perspective. Additionally, we don't agree that this will fully change the environmental impact. 95% of the drugs in our water that is found is through excretion. So it's because we're taking drugs that they're in our water. It's not because they're being dumped. So with all those concerns, and I'm running out of time, I just want to let you know that we have to oppose, but I greatly appreciate all the support from your team in allowing us to be part of the conversation.
All right, thank you. Morning.
Hi, good morning. I'm Angel Burnell. I'm the police chief in Mill Valley. I was asked to give a law enforcement perspective. A great deal of what I wanted to say has already been covered, and I don't want to repeat what other qualified people have had to say, but I wanted to just make a few points. Some of the issues relating to drug abuse and prescription drug abuse with teens, and some misconceptions is that medications are prescribed by doctors and are obtained through either doctors, pharmacies, friends, or families. And so oftentimes people feel that because they're prescription medications, they're safe to take and they're safe to use, and it's not always the case if they're not prescribed for the individual. The Marin County School Resource Officers have had discussion regarding pharmaceutical use by teens and within our schools, and there's a consensus that abuse is on the rise within our schools, unfortunately. A highlighted case was one in San Rafael where a female juvenile arrived under the influence of prescription medication and required a visit to the hospital. Throughout the county, there have been a few cases of children who have brought prescription medication to school with them. In Mill Valley, a juvenile had taken over-the-counter cough medicine called Triple C, which has dextromethorphan in it, and had given it to other students with the intention of over-medicating to cause hallucinations. So we're seeing this from time to time within our schools and sometimes out in the community as well. There are a number of drop-off locations in the county as well. Unfortunately, only 16 of them, which is clearly not enough, one of them being in the city of Mill Valley at our police station. The goal of our programs currently is to keep the medications out of the sewer system and out of the hands of people who for whom they're not prescribed to. Annually, we collect about close to 800 pounds of prescription medication just at our location. Proper prescription medication disposal compliance would surely increase if patients could simply return the unused medications to the pharmacies where they were obtained. Some things that we can all do to improve the situation is to lock up medications, don't make them available to people for whom they are not prescribed. Discuss with our family members the danger of abusing prescription meds, and set a good example by not abusing prescription meds ourselves. Report suspicious online pharmacies, because unfortunately their prescription meds are readily available online, and that's problematic as well. Dispose of medications at your local police department, and participate in the National Take Back Days. Mill Valley is going to host one on September the 26th. This is sponsored by the DEA. And then pass a proposed ordinance requiring pharmacies to receive the unused medication. Thank you so much.
Thank you. Morning.
Good morning. My name is Kathy Wall. I work at Marine Sanitary Service, and I am the Household Hazardous Waste Coordinator. So I want to actually let you know why we should be keeping this pharmaceutical waste from the solid waste stream, and why this pharmaceutical waste shouldn't be going to our hazardous waste, household hazardous waste facility. So actually, I have to do a lot of compliance because of my job, and when I was looking at the regulations, it was really tough to find pharmaceutical waste as solid waste or actually hazardous waste. So what I have to do was to actually go to the Medical Waste Management Act. So I'm going to base what I'm going to say pretty much on the regulations, because I think that this will be really easy to understand this issue. So what I find out is that in the state of California, home-generated medical waste is not regulated. So this is actually a big gap, because it left marine residents without an option, a properly option to dispose of the hazardous waste, pharmaceutical waste. So it says on the Medical Waste Management Act in section 1176/90 says that medical waste means any biohazardous, pathologic, pharmaceutical, or trace chemotherapy waste not regulated by the Federal Resource Conservation and Recovery Act. And under section 1177/47 says that pharmaceutical means a prescription or over-the-counter human or veterinary drug, including but not limited to a drug as defined in section 1099/26 of the Federal Food, Drug, and Cosmetic Act. So it also says that medical waste does not include hazardous waste, radioactive waste, or household waste included but not limited to home-generated sharps waste. So, under the Medical Waste Management Act, pretty much all these things are covered for small and large generators, but again, the homeowners have left. So I think that actually this ordinance is a solution to close that loop. We, as a household hazardous waste facility, have worked for a long period with EPR programs, Extended Producer Responsibility, and they really work. Right now, I work with Call to Recycle. We actually collect rechargeable batteries, and we have Paint Care. And those two programs are very successful, and they really divert waste from landfills. And then the last thing that I'm going to say, because I think that Judy, you actually asked about this, but part of the treatment says that these companies that generate this waste, they should be treating this waste before it actually goes to the landfill. And then it says that one of the methods is to actually treat this waste in any of these manners. And I'm sorry, I need to look at this.
Thank you. Did you have, you're up, but you're out of time,
sorry.
but
okay,
you're desperately looking for something.
Yeah, well, it pretty much says that incineration right now is a solution. And unfortunately, we have to wait until other technologies, get created that can be cleaner and, kind of harmless environment. So thank you for your time.
Thank you. Good morning. Still morning.
Good morning. Hi, Mark Dale. This is a beautiful day. And I got to say, many thanks to the people in this room, obviously. Never envisioned 5 years ago when this process started that we'd be here today. Want to give a big thanks to Marin County Pharmacists Association and the members who were previously of the Marin County Prescription Drug Abuse Task Force. I've been asked to address OTC and really what that encompasses. Our son, 8th grade, got in trouble with a number of other students around robotripping, Robitussin cough syrup, DXM, dextromethorphan. That's the key ingredient. It's called poor man's PCP. It is very dangerous, high psychotic dynamics, very, very difficult. And it almost killed him the first time. April 30th, 2010, Kaiser, his heart rate was 250. They said, we're not sure he's going to make it out. He'll either stroke out or have a heart attack. No family should have to go through that. Then you go to the other end of this. How many families have had catastrophic losses from losing their kids? Or how many kids have lost their parents or even grandparents to this in this county? This is real. So when you hear about costs, what is the cost of a loss of life to this county? You can't equate it to a fraction of a penny on a prescription. Who's responsible? I think that this is a broad, sweeping thing that we need to deal with. I'd love to close with something that's really important. I was at a briefing last week in Alameda County where the law firm that handled this entire ordinance for Alameda County all the way up to the Supreme Court shared some information. Basically what this came down to was a stipulation that was entered into very early in the game. It had to do with environmental health and public safety. When it got all the way up to the Supreme Court, U.S. Chamber of Commerce filed amicus briefs, friends of the court, and usually those are very successful. They were arguing about commerce. This is not about commerce. This is about environmental health, public safety. Finally, when you bring a program like this into Marin County, it creates messaging that's very important. If you're going to change the norms in this county, it's about taking responsibility of the drugs in your home, lock them up, put them away, dispose of them properly. It's very important. I don't want any other family to go through what we've gone through, any other family to lose their loved ones to any of this. Thank you.
Thank you. All right, I think you're our last speaker. Good morning.
Good morning. My name is Renee Goddard, and I am a town council member in Fairfax. I come at it a little bit from a 360-degree perspective in that I am the Ross Valley representative to the local task force for the Solid and Hazardous Waste, JPA, and I'm one of the co-chairs of the Ross Valley Healthy Community Collaborative. So it's a pleasure to speak with you today. I want to thank you for taking this up in such a timely manner. I say timely, Supervisor Connolly, because it's taken me 1.5 years to get a stop sign put in Fairfax. So I take this as a great victory. I've been part of the working group, and to work with such a diverse group of stakeholders has been a pleasure. I can assure you that due diligence has been done. And I want to thank the pharmaceutical industry representatives who took part in this, because it gave us a breadth and some information that we really wouldn't have had in crafting such a well thought out and complete set of recommendations for you in this ordinance. We're inheriting the debt for the unfinished business of the pharmaceutical industry. The county, the municipalities, and our very underfunded nonprofits are doing all of the public education. Local law enforcement time is spent promoting the precious few take-back days, and I want to thank whoever's responsible for giving us one more take-back day on September 26th. The police chief in town informed me that, hey, let's gear up, let's get out there and collect this stuff. People wait for this to happen. We missed the one in the spring, which speaks to the fact that in people's medicine cabinets, things are just sitting and waiting to be either properly disposed of or taken to the wrong place. So the law enforcement is also responding to all of the overdose calls, as you know, and the threats to public safety, which they answer to. The water and the sanitary districts are employing our ratepayer-supported staff and assuming the cost of the state-of-the-art technology in order to mitigate the chemical harm done to the environment and to public health. It's time that the producers share in the responsibility, and I look forward to continuing to work with them. It's not an abdication. It's not a transfer of responsibility. It's an opportunity for the public to come in where the public should as educators, and consumers get educated, prescribers get educated, and then you guys have heard all the rest of the food chain in this. I've recommended that the Fairfax Town Council approve a resolution. It's agendized for our August 5th council meeting in support of the county's ordinance, and I want to assure you that we are ready to work together, and thank you so much for taking this up.
Okay. Thank you. Okay. Thank everyone who came to speak today. You have said it all. Collectively, I have one question I'd like, a point of clarification I'd like to ask staff about, and that's with regards to what medications are covered. I realize that this does cover veterinarian medicines as well, but we didn't call that out, but that is in the ordinance. And then also, if you could speak to the point about whether herbals are included or not, and why or why not.
Sorry, Fred. Yeah, so the ordinance does include veterinary products. It includes, as we mentioned, all prescription medications and over-the-counter medications that are classified in a certain way. There are some medicines that are sold over-the-counter in pharmacies, such as herbal supplements and vitamins, that are not classified in the way that medicines like aspirin and Tylenol and ibuprofen are. In following what's been mentioned in terms of the lead and the established consensus that's growing regionally around the formation of these ordinances, we, like San Mateo, San Francisco, and Santa Clara County, will not be including herbal supplements in this ordinance.
All right, and then, any other comments here? And then we'll go ahead and do the first reading, I hope.
Yeah. I'll be very brief, but I do think that this presentation and involvement today warrants just an observation on my part, and it's that this is what I consider excellence to look like in public policy. It involves identifying the problem. It involves gathering up a wide range of opinions and bringing everyone into the discussion, creating a larger context where we relate it to national and statewide priorities as well as our own general plan goals. It also has sufficient time for public discussion and sufficient time to actually organize the implementation of it. And so just as an example for our board, I would just encourage us to recognize what we have organized. I want to thank you as President, Supervisor Rice, for leading us in this. And I want to especially thank Alameda County for having the courage and the willingness to take the real heat to set the stage for all of us today. But this is an outstanding example, and I want to believe that all of you will respect the fact that we need no comments at the merit hearing. Thank you.
Yeah, and you hit the nail on the head with regards to the public policy and the efficacy and inclusiveness of this effort. Truly, just everyone that spoke today, and there were folks from the pharmacy, from the Retailers Association. I mean, this was an inclusive process, and it was not only inclusive, but it was efficient. It has only been a couple years. RxSafe Marin, and then this broader effort has accomplished quite a bit, with this being the most recent accomplishment, this ordinance. But I also want to highlight the fact that this collaborative effort has extended outward regionally, and Jenna touched on it, and Rebecca touched on it a little bit about how we're collaborating with the other counties, and we're sharing resources and learnings from the ordinances that have been drafted and the plans that are coming in. So this has also been a model in my mind of outside regional collaboration and cooperation, and I really want to thank you folks for helping to make that happen, and to those from the other counties for being so collaborative as well. So with that,
I'll move the first reading.
So I have a
second
motion and a second for the first reading. All those in favor? Aye. Patrice.
Ordinance of the Marin County Board of Supervisors amending the Marin County Code by adding Chapter 7.90, Section 7.90.010 through 7.90.150 to require any person who produces a drug offered for sale in Marin County to participate in an approved drug stewardship program for the collection and disposal of unwanted drugs from residential sources, to provide for implementation, enforcement fees and penalties, and to make environmental findings.
Okay, and with that, we will merit hearing is set for August 11th, and you all can come, and you don't necessarily need to comment, but that will be the day we take action. Do I need a motion to set the merit hearing as well? We did. We did the first reading, and we're all done. We're all done. All right. Thank you.